Hey, what's up? It's Dr. Toby, physical therapist and health coach. And in this video, I want to show you 3 beginning exercises you can start doing to strengthening your knee after you've had a surgical procedure or an operation or an injury. So maybe you're post-op ACL replacement, or you've had a meniscus injury or a total knee replacement. Here are some basic exercises that can help you in your recovery process. Now, a lot of people that I've worked with who've had these operations, maybe they did physical therapy for some time, but they have been discharged from therapy and they're trying to find out how can they continue to strengthen their knees after having a procedure or after being discharged from therapy because they know they're not at 100%. Here are 3 exercises that are really critical and going to help you to see some improvement in terms of reducing pain on a daily basis with everyday activities that you still may be having, improving mobility of your knee, and helping you to get stronger at the same time so that you can get further back to where you were in terms of your 100% self. All right, so let's get right into it. The first exercise that I'm going to show you is an exercise that you can do while you're lying on your back. It's extremely effective for helping to relieve pressure from your knee, improving mobility, and gaining strength. Let's get into it. So this first exercise is simple. It's called a bridge. And there are ways to progress all these exercises. As basic as they may seem, they can be extremely effective and actually extremely challenging if you do them in the right way. So first, with the bridge, we're on our back. And we are here, okay? We're here on our back, and you cross your arms and you push your hips up and forward and you squeeze your bottom. Now, most people might just do bridges like this, going up and down. You really shouldn't be arching your back. Your back shouldn't be arched. You should be lifting from your hips. You can see the initiation here is different versus arching my back, right? I'm not arching my back. I'm actually getting some good core activation here too if I'm doing this right. And how we make this more challenging is holding it for 5 seconds. So if you want to get stronger, building strength and endurance, reducing pain with activities like standing for long periods of time or other activities that may be leading to discomfort in your knees, you want to focus on doing holds with your reps and sets. So 5-second hold, 3 sets of 10, really great way to build strength in hamstrings, glutes, and overall improving knee stability and strength, okay? Now, how we make this more difficult is a couple of ways. So we can use some resistance bands. You can put some resistance bands right around your legs, and I'll demonstrate in a moment. All right, so resistance bands right here. I put it right around my legs. I'm here. Same concept. Here, my feet are about shoulder width apart. Knees are not in. My knees are away from one another, but my feet are pointed straight. I hold this resistance band and I lift up. Now we're getting some external rotation of our hips, which is helping to strengthen our knees, significantly improving muscle coordination. So that's going to be really helpful. Now, one of the things I do for my athletic patients who are athletes is I have them go right into doing single leg bridges with resistance bands. So we have our hip here. I'll show you on this side. 90-degree angle at the hip, 90-degree angle at the knee junction. And we're here and we lift up. This is really good. We have co-contraction of our hamstrings and quads, really a helpful exercise. So that's a way to progress it. Again, using holds, but start off with what you can do in terms of what is going to be most effective, right? If you're struggling to do single leg, probably start off with double leg first, okay? The other exercise that's extremely helpful, seems really simple and really basic, but it's going to be really beneficial. So a long arc quad is really helpful. So long arc quad is you're sitting and you kick your leg all the way out, point your ankle back, squeezing this muscle, holding it for 5 seconds. Now the hold is really important because that's going to help you to generate more muscle fiber activity, meaning that after an injury, after a procedure, all of the muscles of your quadriceps are not going to be contracting or firing as they used to, right? So let's say you have 100 muscle fibers and normally before an injury, 100 of them would contract when you're doing activity, but after a procedure or after an injury, maybe only 50% of them are contracting. This hold that you're doing is going to help to create more muscle fibers reawakening and reactivating. So that way on a daily basis, when you're doing exercise and when you're going up and down stairs or walking for long periods of time, you're getting more support from the muscles that are there versus getting a lack of support, which leads to more pain and discomfort. Okay. So same thing, 3 sets of 10, 2 sets of 10, 5-second hold, incorporating it that way, doing whatever feels comfortable for you. When it comes to specific exercise prescription, as far as what's going to help you to reach a particular goal, the best thing you can do is talk to a PT and get some guidance on where exactly you are. So in the absence of that, you'll have to go on your own and figure out the right amount of reps and sets you should do that's going to help you to build muscle as efficiently and effectively without injuring yourself. But the good news is that if you need some guidance from a PT on how to approach creating reps and sets to build your strength, there's a link in the description where you can talk to a PT first, talk to one of our physical therapists, and we will give you some guidance on how to do that 100% free of charge. So next, this is one of the most effective exercises for building strength and for getting back to a physically active life. So it's called a sit to stand, where you're going from sitting down to standing up, and you're going to do this multiple times. It's similar to a squat, but your form is extremely critical. And this is one of the things that we have to train people on frequently. So feet shoulder width apart, feet pointed straight, knees should not be in, knees should be pretty wide, okay? You're sitting at the edge of the chair, you cross your arms, you lean forward. This requires a good amount of hip mobility. Lean forward, and I'm right here. As you can see, my knees have not caved in, they're still here. Push my hips forward, squeeze my bottom as I stand up. Come back down. As you see, when I came down, my knees didn't cave in. My knees didn't even shake a little bit. I came down, I kept my knees apart, and I'm sticking my bottom back. See, my bottom is sticking back. So what people have a tendency to do when they're sitting down is they bend their knees. You see how my knees are going forward versus I'm sticking my bottom back and my knees are staying in a nice perpendicular position to the ground versus doing this, putting way more torque on my knees. So sit to stand, when you do it correctly, is an extremely effective exercise. Knees apart, lean forward, push your hips forward, squeeze your bottom. So what we learn and we teach with this exercise is initiating from your hips, because your hips are also responsible for why there's pain and discomfort in your knees if your hips are either weak or just not active because of the way that you move and do activities and you rely totally on your knees. So most people, even when they do squats, they squat forward this way, and you can see the angle of my knee and of my shin bone. The angle is not perpendicular to the ground, or it's an acute angle, versus I'm sitting back here doing a squat, getting more hip mobility. And as you can see in this position, my shin bone is more perpendicular to the ground, but this does require more stability, more hip mobility, but this is a great way to practice. And you can start off here, standing up, squeeze your bottom. Good. Squeeze my bottom. I'm sitting back, squeeze my bottom. Good. How we make this more challenging? Utilize bands, and from there, the sky is the limit. You can do so many other type of things. So hopefully if you found this video helpful, we're really glad that it would benefit you, but leave a comment and let us know what you found most helpful. Go ahead and also like the video, and if you find it beneficial for any people that you might know, share it with them. If you are new to our channel, go ahead and hit the subscribe button, because we make videos to help you stay healthy, pain-free, fit, and mobile. And if that's something that you're interested in, being an active, healthy individual and recovering or avoiding injuries, stay connected to our channel by hitting the subscribe button and hit the bell notification to stay up to date on all the videos that we release. Now, if you have suggestions or need particular recommendations for certain things, whether fitness, weight loss, injury recovery, and we may not have a video on it, or you're not sure if we do, leave a comment and we can direct you to one of our videos, or we'll make one for you. So this is Dr. Toby here, signing off. Take care. See you next time.